Triage is used anytime a scarcity of healthcare resources exists. It is a systematic assessment and categorization of patients by likelihood of survival with the available resources. There are many assessment systems used in triage, each having their own benefits and drawbacks. For this course, we will use the SALT system of triage. It is considered the new national standard. It has two basic steps. Step 1. Sort. You want to sort the patients by severity. Walking wounded, minimally wounded, and critically wounded. You can do this in 2 steps. Tell the patients that can walk to move to a site that you select. They will be assessed last. Tell the remaining patients to wave. Those that cannot wave or do not make any purposeful movements should be assessed first. They are most likely to need life-saving interventions. The second step in SALT is to assess. Individual assessment should begin with rapid life-saving interventions that are within the responder's scope of practice, to include control of major life-threatening hemorrhage, opening of the airway. If the patient is a child and not breathing, give 2 rescue breaths. And if they present with a tension pneumothorax, decompress. You next want to assess whether or not the patient is breathing. If they aren't, they are considered dead. Have an assistant mark them with a black tag and move them to a secure location. If they are breathing, ask yourself the following questions. Do they obey commands or make purposeful movements? Do they have a peripheral pulse? Is their breathing controlled? Are all major hemorrhages controlled? If the answer is yes to all of the above, and their injuries are minor, they're considered delayed. Have an assistant mark them with a yellow tag and move them to a secure location. If the answer is yes to all of the above, and they have any major injuries, they are considered minimal. Have an assistant mark them with a green tag and move them to a secure location. If the answer is no to any of the above, and they're not likely to survive their wounds, given the resources at hand, they are considered expectant. Have an assistant mark them with a gray tag and move them to a secure location. If the answer is no to any of the above, and they are likely to survive, given the resources at hand, they are considered to be immediate. Have an assistant mark them with a red tag, treat them, and transport to a higher echelon of care. Once the assessment is concluded for each category of patients, initiate treatment and transportation to a higher echelon of care in the order of immediate, delayed, minimal, and then expected.